Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. On this video you're going to hear the background suction noises and any conversation between me and the client. It's been a while since I've done one of these, and I'm using an app on my iPhone, and I wanted to see also whether when I narrate I can increase my voice over the suction, so you can kind of have the best of both worlds. I know some people don't like the suction noises, but a lot of clients who are attending my clinic are asking, well, they're suggesting it might be a good idea to sometimes, because they watch my videos prior to attending, and some of them have said, oh, it'd be nice for them to know what it sounds like prior to coming with all the suction noise, etc. So now this is a really impacted earwax. I will also it's earwax laterally where we are at the moment, but more medially, you'll see that in a moment. They have got a bit of keratosis obturans now, so really severe impaction. You'll see once I get this outer layer out. I'm using a Jobson horn here just to scoop out the lateral wax near the entrance. I went in with suction. It was a bit difficult to suction that. So I've got half of the wax out. Now, the ear canal is very bruised behind, so you can't see at the moment. When I start removing this more medial wax, the ear canals are severely bruised, which means this plug of wax and skin is expanding, and it's actually widening the ear canal. So here I'm on the lateral part, so I'm just using a Jobson horn just to lift it away from the canal wall. So I read a few comments on yesterday's videos, why didn't I use a ear hook deep in the ear? And this is a perfect illustration really why. So let's just show you. So you can see there's a bit of bruising at the base of the ear canal there. So it's a bit of skin. We're going to come back for this actually, so don't worry too much about this at the moment. Whenever I perform wax removals, I try and just try to alleviate the patient of their symptoms. That's why they're there. So even if we don't get all the wax or skin or hair out, as long as they can go out hearing better, that's what they've come in for. So generally speaking, I like just clearing the blockage first, and then I can always come back and tidy up, and if it's not uncomfortable for the patient. So just some dry wax coating at the back of the ear canal near the entrance. We're just going to peel this off. You can see there's quite a few hairs there, they're matted. So we used a Jobson horn and an ear hook laterally on the cartilaginous portion of the ear canal. But when I remove this in a moment, you'll see that where the wax plug is, because it's getting bigger and bigger and bigger, and it's expanding, it's severely bruised the ear canal. So for me to then to use an hook or a Jobson horn in that region of the ear canal will be very uncomfortable for the patient, and that's why I kind of do stress. There was some reference made to some other channel, China I believe, where they use ear hook quite a lot. Well, I've been watching some of those, and some of the patients are severely bleeding, and also and that's fine, because I think the patients in those procedures, some of them are under anaesthetic as well, some under general, so you can kind of comparing apples and pears in some ways. So, but I just thought this is a good follow-up video because it really shows the essence as to why I do what I do. We don't want to cause any discomfort to the patient wherever possible. We want it to be as a pleasant experience as possible. You can imagine you having your ears cleaned out for the first time. You can be quite apprehensive going. We've got all these instruments. It can be a bit daunting. It's like going to the dentist for the first time for a lot of people. So we don't want to add to that anxiety at all if possible. So because we're on the bony part now, again, I'm just because this is coming out with suction, I'm just going to persevere with suction. Just if it's coming making loose, then we carry on. It's quite a lot of dead skin there. I promise you will see it in a moment, the bruising of the ear canal due to the expansion. So this plug of wax and skin, it's a bit like, so I would say it's actually a bit of keratosis obturans deeper in the ear. It's the skin and the wax is just building up, and it's the plug's getting bigger and bigger, and this is just trapped inside the ear. So eventually it's going to start compressing against the canal walls, and it can cause widenings of the ear canal. It can be very, very painful for the patient because you've got this bony part of the ear canal being stretched open by an internal plug of wax and skin. And in a minute, you will see, I'm going to put some drops in, I think, as well. So you can start seeing the bruising there. Can you see that? And that's the wax plug. It's just compressing against the ear canal walls. And imagine me then putting a hook or Jobson horn, gliding it in between the wax plug and that part of the ear canal. It's going to be so sensitive for the patient, really sensitive. So just put some olive oil just to loosen this last plug. I'm going to go back in. I'm going to try and upload another video today, so stay tuned. It's of a mastoid cavity, and I'm just removing dead skin. So I've got so many videos that I need to get off my IKF because I'm losing memory now. So I'll try and get that done today, so stay tuned. So you can tell this has been for a while. You can tell by the colour, it's really dark, it's oxidised, it's a plug, it's really impacted. But slowly but surely we're just loosening it off the ear canals. You can see the bruising underneath, it's becoming more and more visible now. Don't worry about that strand of hair that you can see on screen, and that's going to come out at the end. As I said, I just want to remove the main blockage. And when you've got keratosis obturans, and which is what this is now, the canal around it is also slightly inflamed, and it engulfs itself. It's the only best way I can describe it, like a pea in a pod. It engulfs itself around the plug. So the plug is almost, although it's expanding outwards, the canal is around it, the perimeter is closing in on it. So it's a double whammy, so it's really difficult to remove, and that adds to the compression in the ear. And that compression, so you can imagine the relief when we remove this plug. It's almost like a plunger effect. When you've got a blocked sink and you get a plunger and you remove the plunger, imagine that release of pressure. Similar to with your a boiling pan of water and you've got a lid on, or a pressure cooker. And that release of pressure when we remove this plug, and air can then get towards the eardrum. So you're going to start seeing the skin of this plug now. You can see it's a bit white there on the right hand side. So that's the undercoat. That's what's sticking itself to the canal wall and making it really difficult to remove. So I'm just peeling it off the anterior canal wall. You can see this fresher layers of skin. And that's what keratosis obturans is. Keratosis obturans, it can be difficult to distinguish that from a wax plug. And sometimes you can get elements of both. But keratosis obturans is exclusively dead skin that's not shedded from the ear canal. And it's just trapped, it's died, it's remained in the ear. Then you get another layer that's died. And it attaches itself to the previous layer. And over months and years, it will just form a plug. And similar to yesterday, it's a bit like a chewing gum. You can see the suction probe. It's kind of indenting itself, but it's a really difficult thing to remove. You just have patience. Patience is a virtue. I think sometimes that's forgotten when we're doing medical procedures or healthcare procedures. And patient comfort. We've got to make sure the patient's comfortable at all times. And slowly but surely, with a bit of, as I said, guile, which is going to come out. And if you keep watching, you'll see just how much compression this is causing the canal wall, how much bruising, redness, soreness. And we don't want to add to that. And so this is the most comfortable method for us to remove this. You can see all that bruising there, how red it is, and you can see the ear canal has expanded now. Near the entrance here, the patient's got a little cave, a little trench, and it's so important we clear that because it can then develop into a canal cholesteatoma. So the skin, as it's dying and shedding, it can get trapped in this little cave, and it can go unnoticed actually. With an endoscope, because of the view, we can really see. You can see how deep this is and how much actually removed out there. So be really careful, and whenever you see a case like that, try and remove as much dead skin as you can, because we don't want that to form into a cholesteatoma. I hope you enjoyed that video, guys, and it kind of makes sense to yesterday's video as well. Stay tuned, I shall upload the other video shortly. Thank you, bye.